Welcome, future nurses! You're now on day 16 of our 30-day NCLEX challenge, where we're solving 30 full-length practice tests and tackling 2,000 of the most repeatedly asked NCLEX questions, the kind that show up in the real exam. But before we jump into today's high-yield questions, here's something incredible just for you. We're offering 5 days of free access to our complete NCLEX crash course. No payment, no conditions. Just click the WhatsApp link in the description and say hi. Our team will instantly enroll you and send you direct access to live and recorded NCLEX classes, next-gen NCLEX case study questions, 5,000 previously asked NCLEX questions, study planners for 1 week and 1 month, PDF notes, and full learning support. All this completely free for 5 days. So don't miss out. Go to the description box, click the WhatsApp link, and say hi. That's it. We'll handle everything else for you. Let's begin the video. To set the stage for our first clinical scenario, a nurse is caring for a client who is receiving a platelet transfusion. The client's blood group is A negative, and the platelets being administered are O positive. Which action should the nurse perform? Here are your options. A. Check the client for signs of hypovolemia. B. Record the findings of the assessment. C. Discontinue the transfusion. D. Contact the primary healthcare provider. The correct answer is B. Record the findings of the assessment, because blood type compatibility matching is not mandatory for platelets. And since the client is tolerating the transfusion without issues, the nurse should simply document the observations. Moving on to our second inquiry. A client with a history of rheumatoid arthritis presents with increasing joint pain, warmth, and swelling after several weeks of progressive stiffness. The healthcare provider writes orders to manage the acute flare. Which medication should the nurse prioritize to obtain? Here are your options. A. Allopurinol 300 mg orally once daily. B. Verapamil 80 mg orally 3 times a day. C. Prednisone 20 mg orally once daily. D. Methotrexate 15 mg subcutaneously once weekly. The correct answer is C. Prednisone 20 mg orally once daily. Because corticosteroids provide rapid control of inflammation by inhibiting multiple inflammatory pathways, suppressing leukocyte migration, and reducing the production of inflammatory mediators. Clients typically notice symptom relief within 1 to 4 days when dosing is adequate, and short-term use bridges the gap while slower-acting DMARDs take effect. Question 4. Building on our postpartum knowledge, while caring for a toddler recently diagnosed with Reye's syndrome, the nurse reviews the child's recent health history. Which antecedent condition is most likely to be noted? Here are your options. A. Cellulitis. B. Influenza. C. Meningitis. D. Mumps. The correct answer is B. Influenza, because Reye's syndrome most often follows a viral illness, particularly influenza A or B, or varicella, within the previous fortnight. Bacterial cellulitis, meningitis, and mumps are not typical triggers. Question 5. Continuing with our ethical decision-making, a client with a newly diagnosed terminal illness asks you, the nurse, to witness her living will at the bedside. What is your best response? Here are your options. A. I'm sorry, but facility policy prohibits me from serving as a witness. B. Let me see if the physician can act as your witness instead. C. Only your family members are permitted to witness your will. D. We'll need the hospital attorney here before you sign. The correct answer is A. I'm sorry, but facility policy prohibits me from serving as a witness, because nurses and other healthcare staff directly involved in a patient's care are legally barred from witnessing advance directives, and any qualified non-staff individual may serve instead. Before moving to the next question, here's something that could change your NCLEX journey. Over 100,000 nurses have already passed the NCLEX using this course. Don't get left behind while others move ahead toward success. We're offering you a free 5-day trial of our complete NCLEX crash course, and it's packed with everything you need to pass live-in recorded classes. Next-gen NCLEX, NGN, case studies, 5,000 previously asked NCLEX questions, 1 week and 1 month study planners, PDF notes and expert guidance, Just go to the description box, click the WhatsApp link, and say, "Hi." Our team will enroll you instantly. Thousands are already learning. Will you catch up or be left behind? Let's move on to the next question. Question 6. Turning to cognitive interventions. During an interview, the nurse recognizes the client is engaging in catastrophizing. Which intervention should the nurse recommend? Here are your options. A. Calculate realistic probabilities and focus on objective evidence. B. Understand that situations exist on a spectrum rather than in extremes. C. Keep a journal of past successes to counter negative thoughts. D. Engage in diversional activities like exercise or social outings. The correct answer is A. Calculate realistic probabilities and focus on objective evidence, because challenging catastrophic distortions requires examining actual likelihoods and weighing data rather than simply reframing or distracting. Question 7. Finally, an infection control nurse reviews 4 clients to determine who is most vulnerable to a urinary tract infection. Which client faces the highest risk? Here are your options. A. A client with a long-term indwelling urinary catheter who is also receiving IV diuretics. B. A client with diabetes mellitus currently on IV antibiotics for a wound infection. C. An obese client undergoing treatment for urge incontinence. D. A client known to have had multiple prior bladder infections. The correct answer is A. A client with a long-term indwelling urinary catheter who is also receiving IV diuretics, because indwelling catheters disrupt natural defenses and rapidly become colonized, presenting the greatest immediate risk for infection. Question 8. Next, the primary provider orders 100 milliliters of 0.9% sodium chloride to run over 45 minutes. Calculate the infusion rate in milliliters per hour. Round to the nearest whole number and enter your answer below. Milliliters per hour. The correct answer is 133 milliliters per hour, because 45 minutes divided by 60 equals 0.75 hours. Then 100 milliliters divided by 0.75 hours equals 133.33 milliliters per hour, rounded to 133 milliliters per hour. Question 9. Shifting focus to pediatrics. A 3-year-old receiving digoxin for congestive heart failure exhibits an early sign of toxicity. Which finding should prompt immediate concern? Here are your options. A. Dizziness. B. Tachycardia. C. Vomiting. D. Failure to thrive. The correct answer is C. Vomiting, because in pediatric clients, gastrointestinal disturbances such as nausea and vomiting often precede cardiac manifestations of digoxin toxicity. These symptoms occur when digoxin irritates the chemoreceptor trigger zone and alters vagal tone, and if unrecognized, they can progress rapidly to dangerous bradyarrhythmias or heart block. Question 10. Turning now to neurology, in planning care for a client with Guillain-Barré syndrome, which action should the nurse perform first? Options include A. Frequent assessment of respiratory status. B. Administration of intravenous immunoglobulin as ordered. C. Passive range of motion exercises to prevent contractures. D. Monitoring for signs of autonomic dysreflexia. The correct answer is A. Frequent assessment of respiratory status, because ascending paralysis compromises diaphragmatic and intercostal muscle function, and early detection of declining tidal volumes or rising carbon dioxide levels allows timely intervention to prevent respiratory failure. Question 11. Moving into critical care, a client in the emergency department is receiving isotonic fluid resuscitation for septic shock. Which laboratory value is most useful in determining whether the intravenous fluids have improved tissue perfusion? Options: A. Serum troponin. B. Serum glucose. C. White blood cell count. D. Serum lactic acid. The correct answer is D. Serum lactic acid, because lactate levels reflect tissue, oxygenation, and perfusion. Levels above 2 millimoles per liter indicate anaerobic metabolism from hypoperfusion, and a falling lactate after fluid bolus demonstrates improved perfusion. Question 12. Stepping into next scenario. When percussing during a head-to-toe exam, over which structure would you normally hear a tympanic tone? Here are your options. A. Stomach. B. Liver. C. Healthy lung tissue. D. Tympany is always abnormal. The correct answer is A. Stomach, because tympany is a high-pitched, drum-like sound produced over air-filled viscera such as the stomach and intestines. Dense organs like the liver yield a dull tone. Healthy lung tissue produces a resonant sound, and tympany is expected over hollow organs rather than always representing pathology. Before moving to the next question, here's something that could change your NCLEX journey. Over 100,000 nurses have already passed the NCLEX using this course. Don't get left behind while others move ahead toward success. We're offering you a free 5-day trial of our complete NCLEX crash course. And it's packed with everything you need to pass, live and recorded classes, Next-Gen NCLEX, NGN, case studies, 5,000 previously asked NCLEX questions, 1-week and 1-month study planners, PDF notes and expert guidance. Just go to the description box, click the WhatsApp link, and say, "Hi." Our team will enroll you instantly. Thousands are already learning. Will you catch up or be left behind? Let's move on to the next question. Now, for question 13, a client with a terminal diagnosis asks you about life expectancy. You share the prognosis exactly as the physician previously explained it. Which ethical principle are you upholding? Here are your options. A. Fidelity. B. Confidentiality. C. Beneficence. D. Veracity. The correct answer is D. Veracity. Because veracity is the obligation to tell the truth and provide honest, accurate information to clients. By communicating the physician's prognosis transparently, you are exercising truth-telling and respecting the client's right to know. For question 14, while monitoring a client's ECG, you observe prominent U waves following each QRS complex. Which serum electrolyte imbalance is most likely responsible? Here are your options. A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hyponatremia. The correct answer is B. Hypokalemia. Because low serum potassium prolongs ventricular repolarization and produces U waves, flattened T waves, and ST segment depression on ECG. Hyperkalemia causes peaked T waves and QRS widening, and sodium imbalances do not produce characteristic U waves. Advancing to question 15, you are preparing to perform a focused gastrointestinal assessment. Arrange the following steps in the correct order, from first to last. Place pillows beneath the client's knees, ask the client to void, inspect the abdomen, palpate the abdomen, auscultate all 4 quadrants of the abdomen. Position the client supine with knees bent and arms at their side. The correct sequence is 1. Ask the client to void. 2. Position the client supine with knees bent and arms at side. 3. Place pillows beneath the knees. 4. Inspect the abdomen. 5. Auscultate all 4 quadrants. And 6. Palpate the abdomen. This order minimizes discomfort, prevents false distension, and ensures accurate auscultation before palpation alters bowel sounds. Addressing question 16. You have 4 assigned clients. Which one requires your immediate assessment? Here are your options. A. A client with a right femur fracture rating pain at 4 on a 0 to 10 scale. B. A client with chronic obstructive pulmonary disease, experiencing shortness of breath while ambulating. C. A client with a thoracic level 6 spinal cord injury 6 months ago, who now has a severe headache and is diaphoretic. D. A client 1-day post-open cholecystectomy with green drainage from the T-tube. The correct answer is C. The client with a T6 spinal cord injury experiencing severe headache and diaphoresis. Because these signs indicate autonomic dysreflexia, a life-threatening emergency that demands immediate blood pressure assessment and removal of the triggering stimulus. Finally, in question 17, a client's serum potassium is 3.2 milliequivalents per liter. Which medication in their history most likely caused this hypokalemia? Here are your options. A. Spironolactone. B. Triamterene. C. Prednisone. D. Lisinopril. The correct answer is C. Prednisone. Because as a glucocorticoid with mineralocorticoid activity, prednisone promotes sodium retention and potassium excretion, leading to low serum potassium. Potassium-sparing diuretics and ACE inhibitors have the opposite effect. Question 18. For our next scenario, a client with a known diagnosis of ulcerative colitis is being assessed. Which finding would you most likely observe? Here are your options. A. Projectile vomiting. B. Frequent bloody diarrhea. C. Absent bowel sounds. D. Periumbilical ecchymosis. The correct answer is B. Frequent bloody diarrhea, because ulcerative colitis is characterized by diffuse mucosal ulceration of the colon and rectum, leading to tenesmus, left-sided cramping, and small volume stools containing blood, mucus, and pus. Question 19. Turning now to substance withdrawal, a client admitted for heroin detoxification is experiencing autonomic and gastrointestinal symptoms. Which nursing intervention best supports the client during this acute phase? Options include A. Administering antipsychotic medications. B. Providing a warm, quiet environment. C. Encouraging increased oral fluid intake. D. Restricting caffeine-containing beverages. The correct answer is B. Providing a warm, quiet environment because minimizing sensory overstimulation and maintaining comfort helps soothe muscle aches, reduce anxiety, and promote rest during opioid withdrawal. Question 20. Shifting focus to respiratory care. A client with chronic obstructive pulmonary disease has been prescribed tiotropium bromide via inhalation. What essential teaching point should you emphasize? Here are your options. A. Use the inhaler once daily, preferably each morning. B. Increase the dose if symptoms worsen. C. Store the inhaler in the refrigerator. D. Prime the device before every use. The correct answer is A. Use the inhaler once daily, preferably each morning, because tiotropium provides sustained bronchodilation over 24 hours, and consistent morning dosing maintains optimal airway patency throughout the day. Question 21. Moving into workplace safety, in designing safe workstations and patient handling procedures, which principle is central to ergonomics? Options. A. Maintaining proper spinal and joint alignment, breaking interrupting pathogen transmission. C. Preventing congenital anomalies before birth. D. Reducing hospital-acquired infections. The correct answer is A. Maintaining proper spinal and joint alignment, because ergonomics applies anatomy and biomechanics to minimize musculoskeletal strain by ensuring neutral posture and correct equipment placement. Question 22. Finally, for critical emergency care, a patient arrives in the emergency department showing signs of septic shock, hypotension, tachycardia, and altered mentation. Which nursing intervention must be initiated first? Here are your options. A. Establish 2 large-bore peripheral IV lines for immediate fluid and medication delivery. B. Contact the infectious disease specialist for guidance on tailored antibiotic therapy. C. Provide ongoing updates to the patient's family about the care plan. D. Conduct a thorough head-to-toe exam to locate the infection source. The correct answer is A. Establish 2 large-bore IV lines, because early vascular access is essential to administer the recommended 30 milliliters per kilogram isotonic fluid, bolus, and broad-spectrum antibiotics within the first hour of septic shock management. Question 23. To underpin a fall prevention quality improvement project with the strongest scholarly evidence, the nurse should prioritize data from A. Expert opinion papers. B. Randomized controlled trials evaluating fall reduction interventions. C. Cross-sectional surveys quantifying fall incidence. D. Qualitative interviews exploring staff and patient experiences. The correct answer is B. Randomized controlled trials evaluating fall reduction interventions, because RCTs provide high internal validity by randomly assigning participants to intervention or control groups and minimizing bias, directly measuring the efficacy of specific fall prevention strategies. Turning to question 24, a client's extremity is cold, pale, and pulseless, signs suggestive of femoral artery occlusion. What is the nurse's immediate action? Here are your options. A. Elevate the affected leg above heart level. B. Apply a cold compress to the limb. C. Notify the primary healthcare provider or rapid response team. D. Perform passive range of motion on the limb. The correct answer is C. Notify the primary healthcare provider or rapid response team, because acute arterial occlusion is a vascular emergency, requiring rapid escalation for imaging and potential revascularization to prevent tissue necrosis and amputation. Shifting focus to question 25, a client arrives with active anterior epistaxis. Which action should you perform to control the bleeding most effectively? Options include A. Sit the client upright, lean them slightly forward, and intermittently pinch the nasal alley. B. Sit the client upright, lean them slightly forward, and continuously pinch the nasal alley for at least 10 minutes. C. Have the client blow their nose forcefully, then apply lateral pressure to the nostrils. D. Instruct the client to bend forward at the waist and hold their nose closed. The correct answer is B. Sit the client upright, lean them slightly forward, and continuously pinch the nasal alley for at least 10 minutes, because sustained pressure over Kieselbach's plexus
allows adequate time for clot formation, and leaning forward prevents blood from trickling into the throat. Question 26. Turning our attention to environmental emergencies, during a home visit, you suspect your client is experiencing carbon monoxide poisoning. What is your first priority? Here are your options. A. Move the client immediately to fresh outdoor air. B. Contact the primary healthcare provider. C. Auscultate the client's lung sounds. D. Check the client's pulse oximetry reading. The correct answer is A. Move the client immediately to fresh outdoor air, because carbon monoxide binds hemoglobin over 200 times more avidly than oxygen, causing rapid tissue hypoxia. Immediate removal from the source and administration of high-flow oxygen are life-saving, whereas all other assessments or notifications must wait until the client is breathing uncontaminated air. Question 27. Shifting focus to pharmacologic safety. A client begins phenelzine therapy for major depression. Which food choice should the client avoid to prevent a hypertensive crisis? Here are your options. A. Smoked bacon. B. Scrambled eggs. C. Milk. D. Kale. The correct answer is A. Smoked bacon, because as a monoamine oxidase inhibitor, phenelzine prevents tyramine breakdown. High tyramine foods such as cured or smoked meats can precipitate dangerous vasoconstriction and hypertensive emergencies, whereas eggs, milk, and leafy greens are low in tyramine and safe. Question 28. Moving into critical thinking and prioritization, you are the emergency department nurse caring for several clients simultaneously. Prioritize these nursing actions by ordering them from first, highest priority, to last. Witness informed consent for a client scheduled for surgery in 6 hours. Assess a client's blood pressure who is receiving a dopamine infusion. Administer a prescribed magnesium sulfate infusion for a client in status asthmaticus. Dress the wound of a client recently discharged after sustaining multiple lacerations to the right arm. Insert a peripheral intravenous line for a mildly dehydrated client and begin prescribed fluid replacement. The correct sequence is: first, administer the magnesium sulfate infusion for status asthmaticus. Second, assess the blood pressure in the client on dopamine. Third, insert the intravenous line and infuse fluids for mild dehydration. Fourth, witness informed consent for surgery. And last, dress the discharged client's lacerations, because life-threatening bronchospasm requires immediate relief, followed by vasoactive monitoring, volume replenishment, time-sensitive legal documentation, and finally, routine wound care. Question 29. Finally, considering traumatic injuries, a 30-year-old man was in a head-on motor vehicle collision and briefly lost consciousness. En route to the emergency department, paramedics note clear, watery drainage from his nostrils that spreads outward on gauze, forming a concentric halo. Which injury does this sign most strongly suggest? Here are your options. A. Depressed skull fracture. B. Linear skull fracture. C. Subarachnoid hemorrhage. D. Basilar skull fracture. The correct answer is D. Basilar skull fracture, because the halo or double ring sign indicates cerebrospinal fluid leaking alongside blood, reflecting a dural breach at the skull base. Although other fractures can cause leaks, a classic halo sign is most characteristic of a basilar fracture. Kicking off question 30. An oncology client is receiving a known vesicant chemotherapy agent via a peripheral IV. Which finding demands your immediate intervention? Here are your options. A. Oral mucosal inflammation and soreness. B. Nausea and occasional vomiting. C. Onset of pain with increasing swelling at the IV site. D. Generalized abdominal cramping. The correct answer is C. Onset of pain with increasing swelling at the IV site, because vesicants can cause severe tissue necrosis if they infiltrate. Pain and progressive edema signal extravasation, requiring you to stop the infusion, aspirate residual drug, and initiate antidote protocols immediately to prevent blistering and long-term damage. Before moving to the next question, here's something that could change your NCLEX journey. Over 100,000 nurses have already passed the NCLEX using this course. Don't get left behind while others move ahead toward success. We're offering you a free 5-day trial of our complete NCLEX crash course, and it's packed with everything you need to pass live and recorded classes. Next Gen, NCLEX, NGN, case studies, 5,000 previously asked NCLEX questions, 1 week and 1 month study planners, PDF notes, and expert guidance. Just go to the description box, click the WhatsApp link, and say, "Hi." Our team will enroll you instantly. Thousands are already learning. Will you catch up or be left behind? Let's move on to the next question. Question 31. Shifting gears to musculoskeletal emergencies, out of these clients, which one is most likely to develop compartment syndrome? Options: A. A client with a left tibial fracture recently placed in a rigid cast. B. A client with bilateral ankle swelling wearing compression stockings. C. A client with chronic osteomyelitis of the right femur. D. A client in skin traction following a left hip fracture. The correct answer is A. A client with a left tibial fracture in a rigid cast, because acute swelling within a non-yielding cast elevates intracompartmental pressure, compromising circulation. Other scenarios don't produce the rapid pressure rise that precipitates compartment syndrome. Question 32. Turning our attention to obstetric assessments, at 16 weeks gestation, you plan to measure fundal height. What should you ask the client to do before beginning? Here are your options. A. Empty her bladder. B. Lie in a side-lying position with knees bent. C. Fast, no food or drink, for 2 hours. D. Prepare for an intravenous catheter insertion. The correct answer is A. Empty her bladder, because a full bladder can push the uterus upward and overestimate fundal height. Voiding ensures accurate measurement from the symphysis pubis to the fundal prominence. Question 33. Moving into pharmacologic monitoring, a client on isoniazid therapy for pulmonary tuberculosis requires ongoing lab surveillance. Which test is most critical? Options include A. Prothrombin time and partial thromboplastin time. B. Complete blood count. C. Blood urea nitrogen. D. Liver function enzymes. AST, ALT. The correct answer is D. Liver function enzymes, because isoniazid carries a high risk of hepatotoxicity. Monthly AST and ALT checks allow early detection of liver injury and timely dosage adjustments. Question 34. Finally, framing your presentation on schizophrenia management. Which statement correctly differentiates treatment challenges? Here are your options. A. Serotonin, norepinephrine. Reuptake inhibitors are the first-line agents for schizophrenia. B. Negative symptoms, such as social withdrawal and apathy, are more resistant to treatment than hallucinations and delusions. C. A high proportion of individuals with schizophrenia engage in interpersonal violence. D. A multidisciplinary team approach offers little benefit in schizophrenia care. The correct answer is B. Negative symptoms, such as social withdrawal and apathy, are more resistant to treatment than hallucinations and delusions, because antipsychotics effectively address positive symptoms but often fall short against negative features, which require adjunctive psychosocial interventions for optimal functional recovery. Question 35. Beginning our psychosocial focus, a client with newly diagnosed acute kidney injury is becoming increasingly worried about their condition. Which nursing diagnosis is most appropriate to include in the care plan? Here are your options. A. Imbalanced nutrition. Less than body requirements related to altered metabolic state and dietary restrictions. B. Anxiety related to the disease process and uncertainty of prognosis. C. Excess fluid volume related to compromised regulatory mechanisms secondary to acute renal failure. D. Risk for infection related to invasive procedures and altered immunity. The correct answer is B. Anxiety related to the disease process and uncertainty of prognosis, because psychosocial diagnoses address emotional and mental health responses. Acute kidney injury carries unpredictable complications that provoke fear of the unknown, and identifying anxiety guides interventions like therapeutic communication, education, and counseling referrals. Question 36. Turning to bladder management, a client reports frequent urinary urgency and incontinence. Which anticholinergic medication is most appropriate to order? Options include A. Dicyclomine, B. Ipratropium bromide, C. Oxybutynin, D. Scopolamine. The correct answer is C. Oxybutynin, because it selectively blocks muscarinic receptors in the detrusor muscle, reducing involuntary contractions, increasing bladder capacity, and decreasing urgency and urge incontinence, whereas the other agents target gastrointestinal or respiratory smooth muscle or motion sickness. Question 37. Moving into central line care. On routine assessment, you find a central venous catheter, dressing that is damp and loose. What is your immediate action? Here are your options. A. Reinforce the existing dressing with paper tape. B. Remove both the dressing and the catheter. C. Cover with a clean, occlusive dressing over the wet one. D. Remove the soiled dressing, cleanse the site, and apply a new sterile dressing. The correct answer is D. Remove the soiled dressing, cleanse the site, and apply a new sterile dressing, because moisture under a sterile dressing compromises its barrier function and increases infection risk. Replacing it using surgical asepsis restores protection. Question 38. Shifting to infection prevention, you are planning care for a hospitalized client with severe neutropenia. Which intervention should you include to reduce infection risk? Options: A. Implement fluid restrictions. B. Wear a face shield throughout care. C. Offer fresh fruits and vegetables at meals. D. Provide the client with a surgical mask when outside their room. The correct answer is D. Provide the client with a surgical mask when outside their room, because neutropenic precautions require protecting the immunocompromised client from airborne and droplet pathogens during ambulation or when visitors are present. Question 39. Finally, reviewing laboratory data, you note a client's serum sodium is 128 milliequivalents per liter. Normal is 135 to 145 milliequivalents per liter. Which current medication order warrants clarification with the provider? Here are your options. A. Hydrochlorothiazide. B. Lisinopril. C. Naproxen. D. Tamsulosin. The correct answer is A. Hydrochlorothiazide, because thiazide diuretics impair sodium reabsorption in the distal tubule and often cause hyponatremia. Continuing it will worsen the sodium deficit and should be questioned. Question 40. Examining this arterial blood gas, a client's results return as pH 7.30, partial pressure of carbon dioxide 50 millimeters of mercury, and bicarbonate 24 milliequivalents per liter. How should you interpret these results? Here are your options. A. Respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis. The correct answer is A. Respiratory acidosis, because the pH is below normal, 7.35 to 7.45. Partial pressure of carbon dioxide is elevated above normal, 35 to 45 millimeters of mercury, and bicarbonate is within normal limits, 22 to 28 milliequivalents per liter, indicating acute carbon dioxide retention without a primary metabolic disturbance. Question 41. Turning now to cardiac rhythms, a client develops symptomatic sinus bradycardia with a heart rate below 50 beats per minute, accompanied by dizziness and hypotension. What is your priority action? Here are your options. A. Document the finding in the chart. B. Call the rapid response team. Continue routine vital sign monitoring. D. Review the client's most recent potassium level. The correct answer is B. Call the rapid response team, because symptomatic bradycardia can progress to syncope, shock, or cardiac arrest, and activating the rapid response team ensures immediate access to advanced providers and interventions, such as atropine or pacing. Before moving to the next question, here's something that could change your NCLEX journey. Over 100,000 nurses have already passed the NCLEX using this course. Don't get left behind while others move ahead towards success. We're offering you a free 5-day trial of our complete NCLEX crash course, and it's packed with everything you need to pass, live and recorded classes. Next-Gen NCLEX, NGN, case studies. 5,000 previously asked NCLEX questions. 1-week and 1-month study planners. PDF notes and expert guidance. Just go to the description box, click the WhatsApp link, and say, "Hi." Our team will enroll you instantly. Thousands are already learning. Will you catch up or be left behind? Let's move on to the next question. Question 42. Moving into home environment assessments, you are conducting a safety evaluation for an older adult at risk for falls. Which recommendation most effectively decreases fall potential? Here are your options. A. Place non-slip mats at all kitchenwork and sink areas. B. Reposition furniture so it occupies the room's center. C. Remove all door locks for easier exit in emergencies. D. Paint walls in contrasting bright colors. The correct answer is A. Place non-slip mats at kitchen and sink areas, because kitchens often have water or grease spills, and mats increase underfoot friction, preventing slips more reliably than furniture rearrangement or cosmetic changes. Question 43. Finally, in our obstetric scenario, a pregnant client at 16 weeks gestation with a history of intrahepatic cholestasis presents complaining of intense pruritus on her palms and soles. Which finding do you expect on assessment? Here are your options. A. Yellowing of the skin and sclerae. B. Consistently low blood pressure readings. C. Elevated fasting blood glucose levels. D. Slow resting heart rate. The correct answer is A. Yellowing of the skin and sclerae, because impaired bile excretion causes bilirubin to accumulate in tissues, and although pruritus may precede jaundice, visible icterus confirms hepatic bile retention. Question 44. Now evaluating obstetric risk. While collecting a pregnant client's history, you identify several factors. Which condition does not increase her likelihood of developing preeclampsia? Here are your options. A. Body mass index in the obese range. B. Pre-existing hypertension. C. Recurrent urinary tract infections during this pregnancy. D. Carrying twins or triplets. The correct answer is C. Recurrent urinary tract infections, because established risk factors for preeclampsia include obesity, which raises inflammatory mediators, chronic hypertension, which worsens vascular dysfunction, and multifetal gestation, which increases placental mass, whereas frequent UTIs do not directly contribute to the endothelial changes or placental ischemia that characterize preeclampsia. Question 45. Next, supervising a student nurse prepping a client for magnetic resonance imaging. Which action by the student requires your intervention? Here are your options. A. Asking the client about any history of claustrophobia. B. Instructing the client to wear earplugs during the scan. C. Relocating the nitroglycerin patch from the chest to the back. D. Explaining that MRI does not expose the client to ionizing radiation. The correct answer is C. Relocating the nitroglycerin patch, because transdermal patches often contain metallic components that can heat or move in the MRI's magnetic field. The patch should be removed entirely before imaging to prevent burns or dislodgement. Question 46. Moving into infection prevention. During unit infection control rounds, which client is at highest risk for a bloodstream infection? Here are your options. A. A malnourished client undergoing alcohol withdrawal. B. A client receiving a short course of methylprednisolone for asthma. C. A client using an external condom catheter for incontinence. D. A client on total parenteral nutrition via a central venous catheter. The correct answer is D. A client on TPN via a central line, because hyperosmolar, glucose-rich solutions delivered centrally create an ideal medium for microbial growth, and any break in sterile technique during line care can precipitate a life-threatening central line-associated bloodstream infection. Question 47. Shifting to pediatric care, an infant with gastroesophageal reflux begins thickened feedings to reduce regurgitation. Which finding best indicates success of this intervention? Here are your options. A. An increase in the number of daily stools. B. A drop in the infant's urine output. C. A noticeably reduced or eliminated regurgitation. D. Measurable weight gain over the shift. The correct answer is C. A noticeably reduced or eliminated regurgitation, because thickening agents increase feeding viscosity, keeping gastric contents in the stomach and directly reducing spit-up episodes. Changes in stool frequency, urine output, or weight require longer observation periods. Question 48. Turning now to postoperative teaching. After your session on vasectomy, which statement by the client demonstrates correct understanding of care? Here are your options. A. This surgery is easily reversible whenever I choose. B. Undergoing a vasectomy will increase my chance of prostate cancer. C. Because I have erectile dysfunction, I can't have a vasectomy. D. I must continue using another form of contraception until my semen analysis shows 0 sperm. The correct answer is D. I must continue using another form of contraception until my semen analysis shows 0 sperm, because residual sperm remain in the distal vas deferens and require multiple ejaculations over 8 to 12 weeks to clear, and only a confirmed azoospermic semen sample allows discontinuation of other birth control. Question 49. Addressing cardiovascular emergencies. A client on a continuous diltiazem infusion develops atrial fibrillation with an irregular pulse, an audible S3 gallop, and 2+ pedal edema. What is your priority nursing action? Here are your options. A. Assess the client for chest pain. B. Perform a 12-lead electrocardiogram. C. Discontinue the diltiazem infusion. Draw blood for an urgent troponin level. The correct answer is C. Discontinue the diltiazem infusion, because diltiazem's negative inotropic effects can precipitate or worsen heart failure, evidenced by the S3 gallop and edema, and stopping the infusion immediately prevents pulmonary edema and hemodynamic collapse. Question 50. Proceeding to question 50, a nurse is assessing reflexes in a full-term newborn. Which finding indicates a normal rooting reflex? Consider the options. A. The newborn opens the mouth and turns the head toward the stimulus when the side of the cheek is stroked. B. The newborn grasps the examiner's finger when it is placed in the palm. C. The newborn extends the arms and legs in a star position when startled by a loud noise. D. The newborn fans the toes upward when the sole of the foot is stroked. Correct answer is A, C, rationales. First and foremost, option A is correct because stroking the side of the cheek elicits the rooting reflex, prompting the infant to turn the head and open the mouth toward the source of tactile stimulation. Before moving to the next question, here's something that could change your NCLEX journey. Over 100,000 nurses have already passed the NCLEX using this course. Don't get left behind while others move ahead toward success. We're offering you a free 5-day trial of our complete NCLEX crash course, and it's packed with everything you need to pass. Live and recorded classes. Next-Gen NCLEX, NGN. Case studies. 5,000 previously asked NCLEX questions. 1 week and 1 month study planners. PDF notes and expert guidance. Just go to the description box, click the WhatsApp link, and say hi. Our team will enroll you instantly. Thousands are already learning. Will you catch up or be left behind? Let's move on to the next question. Question 51. Turning now to acute visual symptoms, a client reports sudden disturbances in vision. Which description best aligns with retinal detachment? Here are your options. A. My vision appears cloudy all the time. B. I feel intense pain above my eyebrow. C. I struggle to see when driving at night. D. I've been seeing bright flashes of light. The correct answer is D. I've been seeing bright flashes of light, because photopsia occurs when vitreous traction tugs on the detached retina, stimulating photoreceptors and often preceding floaters or a curtain-like shadow across the visual field. Let's tackle another scenario. Number 52. A client 48 hours after initiation of cytotoxic therapy for acute leukemia has the following laboratory results. Potassium, 6.4 milliequivalents per liter. Phosphorus, 8.1 milligrams per deciliter. Calcium, 6.3 milligrams per deciliter. Uric acid, 11.2 milligrams per deciliter. Which clinical manifestation should the nurse expect to observe first? See the options. A. Muscle cramps and tetany. Bilateral flank pain and hematuria. C. Peak T waves on the electrocardiogram. D. Polyuria with dehydration. The correct answer is C. Peaked T waves on the electrocardiogram. See the rationale. Hyperkalemia is the most immediate life-threatening electrolyte disturbance in tumor lysis syndrome, and peak T waves on the electrocardiogram are an early and specific indicator of rising serum potassium. Now we will move to question 53. A nurse is assessing a client who believes she may be pregnant. Which of the following findings is a positive sign of pregnancy? Consider the options. A. Bluish discoloration of the cervix, Chadwick's sign. B. Perception of fetal movement by the mother, quickening. C. Auscultation of fetal heart tones with a Doppler device. D. Enlargement and tenderness of the breasts. Correct answer is C. Auscultation of fetal heart tones with a Doppler device. See the rational option C is correct. Auscultating fetal heart tones with a Doppler device, typically detectable by about 12 weeks gestation, is a positive sign, as it can only be produced by the fetus. Shifting to scenario of schizophrenia, question 54. A nurse is assessing a client with a recent diagnosis of schizophrenia. Which finding is considered a positive symptom of the disorder? Here are options. A. Auditory hallucinations. B. Flat affect. C. Social withdrawal. D. Anhedonia. The correct answer is A. Auditory hallucinations. See the rationale. Option A is correct because auditory hallucinations involve perceiving voices or sounds that are not present and reflect an excess or distortion of normal function, classifying them as positive symptoms of schizophrenia. Question 55. The provider orders 1 liter of 0.9% sodium chloride to infuse over 6 hours. At what rate, milliliters per hour, should you set the intravenous pump? Milliliters per hour. The correct answer is 167 milliliters per hour because 1 liter equals 1,000 milliliters. And 1,000 divided by 6 hours equals 166.66, which rounds to 167 milliliters per hour. Question 56, shifting to multiple client care scenario. Several clients have signaled for help at once. Which client should you attend to first? Here are your options. A client with ulcerative colitis reporting 2 bloody stools in the past hour. B. A client with a known cerebral aneurysm who has just developed nausea and vomiting. C. A client on prednisone for an allergic reaction who now has indigestion. D. A client being treated for Bell's palsy who reports new onset tinnitus. The correct answer is B. A client with a known cerebral aneurysm who has just developed nausea and vomiting. Because in the context of an aneurysm, these symptoms may signal rising intracranial pressure or impending rupture, an immediate, life-threatening event requiring rapid neurological assessment and intervention. Moving on to question 57, you are screening clients for risk of hyperosmolar hyperglycemic syndrome, HHS. Which individual is at highest risk? Options include A. A 63-year-old with type 2 diabetes who works outdoors and recently had an increased metformin dose. A 55-year-old with type 1 diabetes hospitalized for pneumonia who occasionally skips long-acting insulin. C. A 15-year-old with type 1 diabetes, hemoglobin A1C of 7.6%, and a 4-pound weight gain this month. D. A 45-year-old newly diagnosed with type 2 diabetes treated with metformin plus glipizide. The correct answer is A. The 63-year-old with type 2 diabetes working outdoors with a recent metformin increase, because older adults with type 2 diabetes, dehydration from insensible fluid losses, and fluctuating glucose clearance are most prone to the profound hyperglycemia and hyperosmolarity of HHS. For question 58, a client with suspected primary hyperparathyroidism is having laboratory tests drawn. Which result best supports this diagnosis? Here are your options. A. Potassium 4.1 milliequivalents per liter. Normal range 3.5 to 5.0. Barium phosphorus 4.9 milligrams per deciliter. Normal range 2.0 to 4.5. C. Calcium 11.2 milligrams per deciliter. Normal range 9.0 to 10.5. D. Sodium 132 milliequivalents per liter. Normal range 135 to 145. The correct answer is C. Calcium 11.2 milligrams per deciliter. Because primary hyperparathyroidism causes persistent parathyroid hormone-driven hypercalcemia. Elevated phosphorus or abnormal sodium or potassium levels are not characteristic of this disorder. Question 59, let's move to an obstetric care scenario. A 39-week gestation client is diagnosed with placenta previa. Which standard procedure must you avoid? Options: A. Transabdominal ultrasonography. B. Abdominal palpation to determine fetal lie. C. Digital cervical examination for dilation. D. Positioning on the left side. The correct answer is C. Digital cervical examination, because inserting a finger into the cervix when the placenta overlies the os risks disrupting placental vessels and precipitating life-threatening hemorrhage. Ultrasound and external assessments remain safe. Question 60. Let's see this. A client with Raynaud's disease has been prescribed ephedrine. What is your most appropriate response? Here are your options. A. Provide the client with dietary guidance for this medication. B. Question the physician about the safety of this prescription. C. Teach the client about possible adverse effects of ephedrine. D. Administer the first dose as ordered. The correct answer is B. Question the physician about the safety of this prescription, because ephedrine's alpha and beta agonist effects cause systemic vasoconstriction and tachycardia, which can worsen Raynaud's vasospastic episodes. You must clarify the prescriber's rationale and advocate for a safer alternative before proceeding. Question 61. Shifting to psychiatric care for scenario, a bipolar patient has just de-escalated after an aggressive outburst. Which intervention best prevents recurrence of inappropriate behavior? Options include A. Review the consequences the patient experienced for their actions. B. Help the patient identify triggers or feelings that led to the outburst. Continue to monitor and maintain the patient's physical safety. D. Offer clear choices for how to manage current behavior. The correct answer is B. help the patient identify triggers or feelings that led to the outburst, because exploring antecedent emotions or situations empowers the patient to recognize early warning signs and develop personalized coping strategies that prevent future escalation. Question 62. Turning attention to neurologic emergencies in a client with a confirmed subarachnoid hemorrhage is at risk for which electrolyte disturbance? Here are your options. A. Hyperkalemia. B. Hypocalcemia. C. Hyponatremia. D. Hypermagnesemia. The correct answer is C. Hyponatremia, because cerebral injury after SAH often triggers non-osmotic ADH release, SIADH, or cerebral salt wasting, both of which lead to excessive renal sodium loss and water retention. This imbalance can exacerbate cerebral edema if not corrected. Question 63. Now addressing to pain assessment, question a client describes pain in their hand as throbbing and sharp. Which category of pain best fits this description? Options are A. Somatic pain, B. Visceral pain, C. Ischemic pain, D. Neuropathic pain. The correct answer is A. Somatic pain, because pain originating from skin, muscles, bones, or joints is typically well localized and described as sharp, throbbing, or aching, whereas visceral, ischemic, and neuropathic pains present with different qualities and patterns. Question 64. Guiding safe ambulation, you're teaching a client how to use a cane safely. Which statement indicates they need further instruction? Here are your options. A. I can hold onto a handrail when I go upstairs for more support. B. I'll lead with my weaker leg when I step upstairs. C. I'll move the cane forward at the same time as my weaker leg. D. I should carry the cane on the side opposite my weaker leg. The correct answer is B. I'll lead with my weaker leg when I step upstairs, because the proper sequence when ascending is to move the cane and stronger leg up first, then bring the weaker leg, ensuring weight remains on the stronger side for stability. Question 65. Addressing pain management concerns, a client resists taking their prescribed narcotic for severe pain, fearing addiction and stating, I don't want to become a druggie. Which response is most therapeutic? Options include A. That's ridiculous. Addiction never happens in people without a history of substance abuse. B. Unrelieved pain carries more risks, like pneumonia and clot formation. And addiction risk is very low in individuals without prior substance use issues. C. Many people choose to tough it out, so you're in good company. D. You can always refuse. Just let me know if you change your mind. The correct answer is B, because it validates the client's fear, educates on the dangers of untreated pain, and the low likelihood of addiction in patients without substance use histories, and supports informed decision-making. Before moving to the next question, here's something that could change your NCLEX journey. Over 100,000 nurses have already passed the NCLEX using this course. Don't get left behind while others move ahead towards success. We're offering you a free 5-day trial of our complete NCLEX crash course, and it's packed with everything you need to pass: live and recorded classes, next-gen, NCLEX, NGN, case studies, 5,000 previously asked NCLEX questions, 1-week and 1-month study planners, PDF notes, and expert guidance. Just go to the description box, click the WhatsApp link, and say, "Hi." Our team will enroll you instantly. Thousands are already learning. Will you catch up or be left behind? Let's move on to the next question. Question 66. Turning to pediatric emergencies. In the emergency department, an infant is conscious but silent while choking on a foreign object. Your immediate action should be to A. Begin chest compressions at 100 to 120 per minute. B. Attempt a blind finger sweep of the mouth. C. Perform abdominal thrusts. D. Deliver 5 back slaps followed by 5 chest thrusts. The correct answer is D, because for a conscious choking infant, you alternate 5 firm back blows, infant face down on your forearm, with 5 chest thrusts, infant supine, 2 fingers at the lower sternum to dislodge the obstruction safely. Question 67. Finally, evaluating infection control practices, you observe a nurse implementing precautions after an in-service. Which action shows correct understanding? Options: A. Wearing a face shield while flushing a client's nasogastric tube. B. Cohorting a client with HIV alongside one who has hepatitis. C. Donning a protective gown when caring for a client with measles. D. Instructing visitors to wear an N95 respirator to enter a TB room. The correct answer is B, because both HIV and hepatitis B are bloodborne pathogens, managed with standard precautions. Cohorting these clients is acceptable as long as strict hand hygiene and safe injection practices are maintained. Question 68. Advancing to question 68, how should you correctly document a weak, thready posterior tibial pulse? Here are your options. A. Grade C posterior tibial pulse. B. Posterior tibial pulse is grade B. C. The client's posterior tibial is 2. D. Posterior tibial pulse is 1. The correct answer is D. Posterior tibial pulse is 1. Because peripheral pulse strength is scored from 0 absent to 4 plus bounding, and a weak thready pulse corresponds to a grade of 1 plus. Using the numeric system ensures clear, standardized documentation. Question 69. Moving on to next. 1. You're providing discharge teaching for a client treated for vaginitis. Which instruction should you include? Here are your options. A. Urinate before sexual intercourse. B. Perform regular vaginal douching. C. Cleanse the vulva with moisturizing soap. D. Wear loose-fitting clothing and cotton underwear. The correct answer is D. Wear loose-fitting clothing and cotton underwear, because breathable fabrics promote air circulation, reduce moisture, and lower the risk of recurrent irritation or infection. Douching and fragrance soaps disrupt normal vaginal flora and pH. Question 70. Turning now to substance misuse education. In question 70, you are teaching a group of adolescents about heroin's dangers. Which statement by an adolescent signals a misunderstanding that needs correction? Options include A. Heroin can lead to addiction and dependence, making it difficult to stop using. B. Injecting heroin increases the risk of contracting bloodborne infections such as HIV and hepatitis. C. Heroin can cause respiratory depression, which can be life-threatening. D. Using heroin with friends at a party is safer than using it alone. The correct answer is D, because there is no safe context for illicit opioid use. Peer presence does not guarantee access to naloxone or competent intervention, and group settings can normalize dangerous behavior. Question 71. See this scenario in which parenting style is characterized by rigid rules, high demand for obedience, and little tolerance for autonomy? Here are your options. A. Authentic. B. Permissive. C. Authoritarian. D. Indifferent. The correct answer is C. Authoritarian, because this style enforces strict discipline and unquestioning compliance without warmth or explanation. In contrast to authentic, balanced warmth and limits, permissive, high warmth, low control, and indifferent, low warmth and control, parenting approaches. Question 72. A nurse overhears a colleague threaten a client by saying, "If you do not behave, I will restrain you." Which legal violation does this statement represent? The options are A. Battery. B. Libel. C. Slander. D. Assault. The correct answer is D. Assault. Let's see the rationale. Assault is a willful verbal threat or attempt to inflict harm that places someone in reasonable fear of imminent harm. Threatening restraint without consent or due process constitutes assault. Now we will shift our attention to question 73. You're preparing a client for a scheduled colonoscopy. Which instruction should you include in your teaching? See the choices. A. You may eat your regular diet the day before the procedure. B. Remain NPO, nothing by mouth, for 4 to 6 hours prior to your test. C. You may notice chalky white stools immediately after the procedure. D. Expect significant abdominal pain and distension when you wake up. The correct answer is B. Remain NPO for 4 to 6 hours prior to your test. Let's see why this is correct choice. Ensuring the bowel is completely empty is critical for clear visualization of the colon lining. Clients typically complete their bowel cleansing regimen, clear liquids and laxatives, by early evening, then fast, no food or drink, for at least 4 to 6 hours before anesthesia and scope insertion. Question 74. Shifting our focus to gastrointestinal counseling, you're advising a client with irritable bowel syndrome on dietary modifications. Which change should you recommend? Here are your options. A. Increase dairy intake. B. Increase fiber intake. C. Increase fat intake. D. Increase calcium intake. The correct answer is B. Increase fiber intake, because both soluble and insoluble fiber add bulk and soften stools, helping regulate transit time and alleviate the alternating constipation and diarrhea that characterize IBS. A gradual increase to 30 to 40 grams per day, along with adequate fluid intake, promotes consistent bowel habits, whereas dairy, high-fat foods, and extra calcium do not directly improve IBS symptoms and may even trigger discomfort. Question 75. Concluding this session with our nutritional assessment, a client's laboratories reveal a low serum albumin level. Which intervention should you include in the plan of care? Options include A. Obtain a capillary blood glucose. B. Implement seizure precautions. Commander, enforce strict bed rest. D. Collaborate with a registered dietitian. The correct answer is D. Collaborate with a registered dietitian, because hypoalbuminemia often reflects prolonged protein energy malnutrition and leads to poor wound healing, edema, and longer hospital stays. A dietitian can perform a comprehensive assessment, calculate increased protein requirements, and develop a tailored meal and supplement plan to correct the protein deficit. Thanks for watching. See you in next video.